Hi, Nancy with the Hospice Care Plan and Odonata Care. We're talking about the roles of all the professionals on the hospice care team. And here I am a nurse, and I haven't talked about the nurse's role. And I would say that primarily the nurse is often seen as the hub of the hospice wheel, and that's because we are privileged and honored enough to be the ones that see the patient generally more often than anyone else on the team. Every hospice department has their own specific way of managing a patient's care, but in the way that we have usually worked in hospice, Brenda and I, the nurse brings the patient onto the hospice team right from the beginning and gets the patient admitted, does a full body assessment, finds out about all their symptoms that need to be managed, and then we help build the initial care plan, asking for help from our hospice team that we've mentioned for the other care needs beyond our services. We do see the patient more often, and generally it runs about 1 to 3 times a week, but of course it really depends on the acuity of the patient. We can see a patient every single day if we need it, and again, it is related to the needs of that specific patient. We try to individualize their care, and as a patient's decline rapid increases in rapidity and there is much more education needed, we often see our patients very often. Every nurse will have her own standards and decide how often her own caseload has needs to be seen. And in my case, when a patient is actually transitioning or getting close to death, I really try to stop by every day or almost every other day to educate and support the family in making sure the patient is comforted and they are also knowing what to do during the vigil. So again, a nurse is mostly responsible for asking for people of the team to meet the needs of the client, of the patient. We're often the ones that notice those because we are there more often. Personally, I, as a case manager, really like to provide the admission process right from the start because it's human nature that we bond to the people that we see the most. And so, if possible, I like to do my own admissions so that we can get on the same foot all at the same time, right at the beginning. And I also like to see my patients within the first couple of weeks, 2 to 3 times, so that we can really get a good feel for each other. I can really look at what their trajectory is, get a feeling for what the needs are, and build that trust that is so important in allowing the patient and the family to receive the information and the education that I have to offer so that they really can live more comfortably and hopefully longer. It is a privilege and an honor to be a nurse in hospice, and we are a part of the team. Please visit our website because you'll see what nurses do. Brenda and I are out there educating and instructing and trying to make the path to the end of life much more comfortable. We are the ones that say care is the beginning of all treatment. Care is treatment. That's our motto. Join us and learn more about hospice care.